So today I'm actually not going to be interviewing anyone. I'm just going to be talking about the different resources that came from the Public Health Millennial Career Stories podcast in 2020. And the order of this stuff that I'm going to be talking about goes from programs and scholarships. It starts from high school, undergraduate specific, undergraduate or master's, school specific, doctoral, and membership. Then I go through a couple of the books, well, the books that have been mentioned on the podcast. Then I go through podcasts that have been mentioned on my podcast, as well as phone apps, social media profiles of different health profiles, not the guests that have been on the show. If you want to check out those, definitely just go and check them out at each individual person's show notes. Other than that, we have some websites, some public health communities that I think everyone can take value from, and courses, and then a couple other resources. And lastly, I just give some final words, some positive thoughts, and some great vibes, I believe. So definitely check that out. And I hope you guys are doing well. Happy New Year. This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 33. Hi, everyone. Omari here. Happy New Year. Thank you all for joining me. If this is your first episode, thank you for joining me if you've been here in 2020. Thank you. I appreciate you listening. Definitely share with a friend, subscribe, leave a review, leave a comment if you're on YouTube, subscribe on YouTube, and all that good jazz. I know 2020 was a hard year for a lot of us, and I'm hoping that 2020 brings a lot of more positivity and a lot of great things. But that being said, I am trying to reflect on 2020. And that being said, here, I just compiled like a bunch of resources from all the other episodes, all 32 episodes that came before. And I hope that you find these valuable. I definitely know that I missed out on a lot of the different resources that people have dropped throughout the different episodes. So definitely go back through and listen to the episodes and have your notebooks ready and whatnot. But I'm going to tell you what order of things I'm going to talk about. So if you're interested in something or not, you can just skip it or not, but up to you. So the different resources, how I categorize them, and this is going to be in a blog post that is released today, actually. So you could follow along on the blog at the PH Millennial episode 33, and that will take you to the show page, show notes page, and then that will take you to that'll be linked to the other page. So you can do that there. But the order of this is going to be programs and scholarships. So I'm going to talk about high school, then undergraduate specific, undergraduate or master's, school specific, doctoral programs, membership programs. Then I'm going to be going on to some books that were mentioned, some podcasts that were mentioned, one phone app that was mentioned, some social media health profiles that were mentioned, and that does not include the guests that have been on the show. If you want their social media profile, just go to their show notes and check that out. A couple different websites that have been mentioned that could be useful to some public health people out there, different public health communities, which I think is a really great one that a lot of you might not know about. So definitely stay tuned to that. And then with some courses and then some other resources. So the first as we start off here, so programs and scholarships, and do forgive me if I mess this up. I'm going to try to shoot all of this in one go and not have to edit anything. Today is Tuesday, January 5th. I'm trying to release this for tomorrow. What is that? The 6th. It's a long week, but I'm looking forward to getting back to work and just getting back in the groove of things and whatnot. But yeah, okay, so let's start. So in programs and scholarships, starting off at high school, there was a Young Scholars Program at University of Georgia, which is a paid 6-week summer internship program for high school students interested in agricultural, food, and environmental sciences. And I'm not going to be reading everything that is on the blog post. So if you want all the information, definitely hit up the blog post and check that out. I'm I'm going to make it easy. So this blog post is going to be the Public Health Millennial slash 2020 resources. So if you go type in the phmillennial.com / 2020 resources, you will come across this page, and they're gonna have links to everything on there. So yeah. So then we go on to undergraduate specific. There's Benjamin A. Gilman International Scholarship, which is a program that works with universities and colleges across the US to encourage and support applicants from public, private, 2 year and 4 year institutions. And then there was a CDC Undergraduate Public Health Scholars Program, or CUPS program, and this is at the CDC's Office of Minority Health and Health Equity, and it supports internship opportunities for eligible undergraduate and graduate students to gain meaningful experience in public health settings. Then we talk about the Project Imhotep with Morehouse College and CDC. Project Imhotep is an 11-week public health internship for undergraduate, juniors, seniors, and recent graduates. The program aims to increase diversity in public health field by engaging underrepresented minority students. Next, we have the Robert E. Mcnair Scholar Program. The Mcnair Scholars Program is a federal TRIO program funded at 151 institutions across the United States and Puerto Rico by the U.S. Department of Education. It is designed to prepare undergraduate students for doctoral studies through involvement in research and other scholarly activities. Next, we have the Fulbright Scholar Program. So the Fulbright is the most widely recognized and prestigious international exchange program in the world, supported for more than half of a century by the American people through an annual appropriation from the US Congress and by people of partner nations. Next up, we have programs and scholarships for undergraduate or masters. So we have the ORICE fellowships, which are ORICE connects the most talented and diverse college students, recent graduates, postdocs, and faculty programs to closely align with interests of variety research facilities, including those managed by the U.S. Department of Energy and more than a dozen other federal agencies. And there are a bunch of like ORICE fellowships related to public health in a whole bunch of different departments. So definitely check out ORICE fellowships if you're interested in getting into some fellowships. Next, we have the PHI CDC Global Health Fellowship, which is a program in the US Centers for Disease Control and Prevention funded that offers recent global public health graduates from Council of Education and Public Health accredited schools and programs the exciting opportunity to participate in fellowships with guidance from leading global health experts from the CDC. I've had a couple of guests on the show who've done these fellowships, so definitely check those out. I think Vanessa DaCosta is definitely one of those people. She's a big resource for PHI CDC Global Health Fellowships too. Next up, we have the CDC Public Health Associate Program, or PHAP, which is a competitive 2 year paid training program with the Centers for the CDC. The PHAP associates are assigned to public health agencies and non-governmental agencies in the U.S. and U.S. territories, and work alongside other professionals across a variety of public health settings. And I know a couple of people who have been in this program. I think Francis is the only person on the show who has been on the program, but I'm going to try to get some more people who have had like CDC PAP experience on the show very soon. Next up is the National Institute of Health Summer Internship Program, or SIP. SIP is a summer program at the National Institute of Health and provides an opportunity to spend the summer working at the NIH side by side with some of the leading scientists in the world in an environment devoted exclusively to biomedical research. Next up, we have the Washington Center, which the Washington Center provides immersive internship and academic seminars to students from hundreds of colleges and universities and young professionals from across the US and more than 25 countries. And then when we had some school specifics, we had TEACS at Texas A&M. TEACS is a program focused on fire and emergency services at Texas A&M University. It comes down to saving lives from providing emergency responders to disaster across the state and nation, developing training and practical workforce solution. TEACS makes a difference worldwide. Next up, we have the Francis L. Phillips Travel Scholarship at the University of North Carolina. And this scholarship provides an opportunity for juniors and seniors in the College of Arts and Science at UNC Chapel Hill who attend high school in North Carolina to engage in individual, self-designed, and directed international travel experience for periods ranging from 2 months to 6 months. Approximately 20 Phillips scholars get up to $9,500 each every year. Next up, we have the Second Century Initiative Fellowship at the Georgia State School of Public Health. The Next Generation program is an effort through strategic faculty hiring to build strength around core and innovative research and scholarships by adding faculty excellence to interdisciplinary research topics, investigating pressing issues facing our society and the world. And then we go on to some doctoral programs that were mentioned. There's the Southern Educational Board Fellowship, which is aimed at helping minority students go to doctoral programs. Next up, we have the Mcnair Dissertation Fellowship at the FSU. And this provides up to 5 years of funding support for newly enrolled African American and Hispanic graduate students who intend to seek a PhD degree. Then we have the Kessler Scholars Program at Cornell University. The Kessler Presidential Scholars Program provides 4 years of support to exceptional Cornell students who are among the first in their family to attend college, helping them achieve their dreams through academic, financial, and social support. So we have a membership program that was mentioned by Neonest Allers, the CSTE membership, which is a Council for State and Territorial Epidemiologists. So if you're interested in applied epidemiology, definitely get it into this membership. I don't think it's very inexpensive. Next, we have books that were mentioned. So some of the books that were mentioned were Tools for Career Success, 101 FAQs about Public Health by Latonia Bynum, the Privileged Poor, How Elite Colleges Are Failing Disadvantaged Students by Anthony Abraham Jack, The Health Gap by Michael Marmot, and this book was mentioned a couple of times. It's definitely like one of the top public health books that people read. Next was Deep Work by Cal Newport, Permission to Screw Up, How I Learned to Lead by Doing Almost Everything Wrong, Christine Hadid, Collie and Bosco the Dog by Dr. Sharon Atipo, Dream Big by Bob Goff, Medical Apartheid, The Dark History of Medical Experimentation on Black Americans from Colonial Times to Present by Harriet A. Washington, Becoming the Boss by Lindsay Pollack, and then lastly, The First 90 Days, Proven Strategies for Getting Up to Speed Faster and Smarter by Michael Watkins. And then podcasts that were mentioned on the show, there was so from guest we have Mejor con Quanabanas by Neonest Aliz, and then there was also Public Health Research Consulting, which was by Leonora Aquara. And then some other public health related podcasts that have been mentioned is the Public Health Epidemiology Podcast, the No Jargon Podcast, Public Health on Call by John Hopkins University Bloomberg School of Public Health, Society for Epidemiology Research Podcast, Public Health Insights, Code Switch Podcast by NPR, America Dissected Podcast, and then some other podcasts that are not really public health related that were mentioned on the show. I think most of these like business related. Master of Scale Podcast, No Little Plans, The Financial Confessions, Best of Both Worlds, Woman at Work by Harvard Business Review, Revisionist History by Malcolm Gladwell, Biz Chicks Podcast. And then there was one phone app that was mentioned, and this was by Latonia Bynum. She created the Chess Exam Study app, so definitely check that out. I think it's available both on iPhone and Android. Next, we have social media profiles that were mentioned, and this does not include guests that were on the show. If you want to get their social media, just check out whatever show they were on, check out their show notes, and they'll have links to that there. So some of the social media profiles were Bridges to the Heart, which is a nonprofit in Trinidad, Open Academics, which is a Twitter profile, I guess data related. I'm not too sure. I haven't been on Twitter as yet. Then we have the John Hopkins Public Health Instagram. You have the Denver Public Health Department Instagram. We have WMC Public Health, and we have How to Talk to Your Doctor Instagram profile. Next is some websites. Some of these people have been on the show. Some of them have mentioned these websites. Actually, I think every one of these websites, except for the last two, from people who have been on the show, and they're just resources for different people. If you're interested in getting services to better yourself in your public health career, as well as if you're interested in like understanding consulting or just broadening your network with consultants, just reach out to these people and they can definitely lead you in the right direction, or reach out to me and I can put you in contact with them, whichever way. So first we have Shelby Graves, so at shelbygravesfreelance.com. We have Women in Pharma Careers, which is womeninpharmacareers.com. We have Roman Public Health Consulting from Leah Roman, and that is romanphconsulting.com. Then we have Create, Critique, and Revise Wizard LLC by Francis Dean, and this is Create, Critique, and Revise Wizard.com. Then we have Chilumbo Global Career Services, which is chilumboglobalcareerservices.com. Public Health Research Consulting, which is publichealthresearchconsulting.com. Actionable Data Consulting, actionabledataconsulting.com. And then the last two websites I will mention was the National Urban League, which is nul.org, and then NAACP, which is naacp.org. Next, we have some public health communities, and these are definitely some that I definitely think that you all should connect to. Well, first and foremost, we definitely have my own that I've been trying to build up, and definitely go and check that out and request to get into the group. Hoping to put out a lot more something in there, but it's coming soon. So definitely make sure that you are in that group. And then we have the Public Health Gladiators Facebook group, and this was the first my first public health group that I joined, and I think that it's very valuable. That a lot of people are having a lot of different conversations on there and just asking questions, and it's a great way to start networking. Next, we have the Public Health Research Network on LinkedIn, and this is also a great group for people interested in public health research. We have Women in Public Health. I think that speaks for itself, and I think that's a group on LinkedIn. Then we have Black Ladies in Public Health, which is a LinkedIn group, and that also speaks for itself. Then we also have Women in Pharma Careers Facebook group, and lastly, Leah Roman's Public Health Entrepreneurship Network group, which you have to request to get into, but definitely some value because Leah definitely just drops a lot of value and is one of the great valuable consultants out there. So definitely check that out. Next up, we have some courses that were mentioned. And we have Contemplating Consulting by Leah Roman. This is, of course, if you're contemplating consulting and thinking about taking a shift from a job into consulting, I think Leah's course definitely lays out the path for you to get there. So check that out. We have Rose Data Studio, Info Call for Biostatistics times Thrive. And this is by Rose Data Studios, which is by Asia Spears. And I haven't had her on the podcast as yet, but she will be coming on in a couple of weeks, definitely. She doesn't know it as yet, but yes, she will be. If she wants to, of course. Then next we have free FEMA courses. So if you're interested in like emergency preparedness, definitely check those out. We have SAS University, which I also believe is free, and then we have some nutrition courses, Mac Nutrition University, and then Precision Nutrition. So then lastly, we have some other resources that were mentioned. And the first one is Toastmasters International, which is a place that you can go if you're interested in developing your public speaking ability. Definitely check that out. The Daily Skim, which is a weekly email updates on what's going on in the news in a friendly format. My sister is the one who recommended this and I actually just like checked it out on her phone. And I'm probably going to tune into that one. And then last but not least, Francis Dean has a Wonder document. And I definitely recommend you to just check that one out because it has a lot of valuable information for anyone interested in different programs and whatnot in public health. So definitely check that one out. So that is a list of resources from the Public and Millennial Career Stories podcast in 2020. I thank you all for tuning in. I hope that you guys have gotten value and that some of these resources will be useful for you either now or in the near future. Thank you so much. And I guess just some final words before I close this out. We will be having some public health chats coming in the time, but I'm just trying to figure out like my schedule and what I have to do, and I have some other things that I'm trying to do. As you all know, I'm trying to finish up that book. I'm trying to figure out some other things to do with the Public Health Millennial. I'm trying to broaden the YouTube channel. So subscribe to the YouTube channel. It's the Public Health Millennial on YouTube. You can probably just YouTube, the Public Health Millennial Career Stories podcast, and it will come up. That's mostly what the content on YouTube is so far, but I'm trying to broaden that to actually talk about things outside of just interviewing people and podcasts and giving value from my perspective, because I think YouTube is a great way to also do that. I've been doing that on Instagram a lot, and I think I'm trying to make that switch to YouTube and I guess give value in that way too. So definitely subscribe there. Um, Thank you all for tuning in. Thank you all for just being here and supporting me. And let me know how I can support you, because this entire platform was built off of just helping people know what public health is, know what they can do in public health, and navigate that path, and give them the tools not to succeed in so much of the exams, but more so the professional stuff that we more so don't know about, and the opportunities out there, and just really getting that mindset. So I think mindset is a big thing. And so yeah, so thank you all, and I really appreciate everything that you all bring to me. There's a lot of joy and happiness, and I'm glad that I'm able to help you all. And I get messages every now and again from people saying that they found information valuable, and that just keeps me going. So thank you all. We'll be dropping more episodes soon. Subscribe to the YouTube channel, subscribe to the podcast. I appreciate you all very, very much. um I don't think I have anything else to say right now, but yeah, so I hope that all of you are staying safe, taking care of yourself, and I hope that 2021 has a lot of great things in store for each and every one of you. And definitely just make sure to be proactive and try to put yourself out there and take on opportunities and push yourself outside of your comfort zone, and you will see that things will come your way. And just perseverance, like even when I started my Instagram blog, my Instagram, my, my Instagram blog, my Instagram profile, like no one was following me for a long time. No one was listening to what I said, but there was just like instances where one person would come and say, "Oh, thank you, this was helpful, and this was helpful," and that was what kept me going. And sometimes we overlook and think that things are more difficult than they have to be, and that puts a mind block on us. But let's just be open in 2021 to new opportunities and expanding our horizons and just doing more. Unless we really need to get public health out there, we really need to get public health out there in positive light, and we really need to advocate for it in all the big ways, because we need more funding to be able to do the things that make the healthy choice the easy choice. We need system change around that. And I think this platform is a great way to just give you all the tools to reach where you need to reach in your career, to do the good work that you need to do. And I'm just looking forward to just dropping more value, interviewing new people, building the network, and connect with me on LinkedIn. Drop into the LinkedIn group and say hi, say what's up, and I will see you all next week. Well, you all see me next week, but I love you all. Take care. Public at Millennial out.